Hello, everybody. This is Dr. Mohamed Kamel, Associate Professor of Physical Therapy, and today I will be talking about important topics for the physical therapy license exams. To be licensed physical therapist in United States, in Canada, and in different countries, you need to pass your license exam. So that's why I'm talking today about some important neuro topics for physical therapy license exams. This is a whole course is running for about 3 months each cycle. And when we start the new neuromuscular part, usually people are missing some important understanding of neuro topics. So that's why today I am bringing some neuro terminology which we need to understand for the course, because we are using these words in answering questions and explaining our content. So you need to be aware of these important neuro terminology. Let's start with the first one. The first one is agnosia. A means without. The capital A means without. So agnosia, akinesia, aphasia. This means A means without. So first one, agnosia. Agnosia, inability to recognize familiar objects with one form of sensation, like visual agnosia. Okay, I recognized your face before, but now when I have a stroke and I am in the hospital and you come to visit me and they asked you, who is that? You didn't recognize me. Okay, so this is one type of visual agnosia, and there are several types of agnosia, but visual agnosia is one of them. Auditory agnosia and different types. Akinesia. A means without. Kinesia means movement. So inability to initiate movement, one of the major impairments of Parkinson's disease. We explaining Parkinson's disease as one of the topics in differential diagnosis of our course. So Parkinson's disease, patients have a problem with initiating or starting movement. Okay, aphasia related to speech. Okay, and there are different types of aphasia. Disturbance to language that results in errors in word choice, comprehension, or syntax. Okay, there are several types of aphasia. And why we have several types of aphasia? Because we have different centers in our brain which are connected to a certain language function. So we have part in frontal lobe, we have another part in temporal lobe, and that's why we have different types of aphasia. The first one is expressive aphasia. Expressive aphasia means non-fluent. It has other names: non-fluent aphasia, motor aphasia, or Broca's aphasia. Okay, I know what I want to say, but there is no speech production. I cannot have the words, or I cannot produce the suitable words to to convey the message to you. So severe difficulty in verbal expression with impairment in object naming and writing abilities, mostly found in those with right hemiplegia. Why right hemiplegia mostly? Most of us are right-handed. So when you are right-handed, then the left side of the brain is, the dominant, side, or dominant hemisphere. So, and mostly if this left hemisphere is affected, this will result in contralateral paralysis, which is right hemiplegia, and this will be usually associated with Broca's or expressive, non-fluent, or motor aphasia. Okay, the next one is I would say receptive first. So receptive aphasia, or fluent, or Wernicke aphasia. This is severe disturbance in auditory comprehension. I would say certain words which has no meaning. Okay, reading, writing, and word recognition are also impaired. The other type is global. Global is everything, means everything is affected. This is the most severe form of aphasia, characterized by reduced speech and comprehension. Reading and writing are impaired as well, caused by blockage of the main stem of the middle cerebral artery. And in our course we are also explaining the circle of Willis, and we know that the middle cerebral artery is the most artery which usually be blocked in a stroke or affected during stroke. Okay, and the fourth type is conduction or associative aphasia, the result of damage to the arcuate fasciculus. Arcuate fasciculus is the connection between the Wernicke area and the Broca's area, or the Broca's area and the Wernicke area, which means the association neural fibers that connects Wernicke and Broca's areas. And we explained that also in our course. Patients struggle with repeating phrases and word finding issues. Okay. The next terminology which we need to learn about today is apraxia, inability to perform movements previously learned, even though there is no loss of strength, coordination, sensation, or comprehension. Okay. If you check my strength, it's okay. It's okay. If you check my coordination, it's okay. If you check my sensation, is okay. Comprehension, to understand movement, is okay. But the problem is that apraxia is how to formulate motor ability or movement through the connection of all these aspects together. Okay, so inability to perform movements previously learned. I was able before to open the car door, to get into the car, and I do this stuff. Now when I got this brain insult, and you ask me to do the same action, I cannot do. Why? So this apraxia, inability to perform movements previously learned, even though there is no loss of strength, coordination, sensation, or comprehension. Additional apraxia, person no longer gets the idea of how to do a routine task, like washing hands or brushing teeth, and this person was, before the brain insult, was able to do that. Ideomotor apraxia, person cannot do a task on command, but can do it spontaneously. You ask your patient to get the walker and start walking. The patient, does not follow command, unable to do the task on command. But when you, went outside the room and you are observing your patient, the patient brings the walker and start to walk. Okay, so the patient, this is called ideomotor apraxia. Person cannot do a task on command, but can do it spontaneously. Gnosis, inability to recognize objects by touch alone. Okay, if I close my eye and you give me, a piece of leather in my hand or a piece of wood, and you ask me, what is that? Okay, and I can, I can feel, this by touch and recognize object, by touch. In here I am not depending on my eyes. Okay, but for these persons who have astrognosis, they have inability to recognize objects by touch alone. Asynergia, inability to move muscles together in a coordinated manner. We have agonist and antagonist. So when the agonist is contracting or doing a movement, the antagonist should be relaxed, and vice versa. And this is called synergy of movement. So people who have a problem with that, they have asynergia, inability to move muscles together in a coordinated manner. Ataxia, uncoordinated movement, especially gait, and usually we see ataxia with people who have cerebellar lesion. Athetosis, slow, involuntary, worm-like twisting motions, usually seen in forms of cerebral palsy. We have athetoid cerebral palsy, and we will talk about that in pediatrics. Causalgia, is burning sensations, which are painful, often associated with complex regional pain syndrome type 1. We will talk about that also. But these are burning sensation, which are painful, and it is not related to like peripheral nerve injury or no, it is related to something more higher in the higher centers in the brain. Okay, chorea is a rapid, involuntary, jerky movements seen especially in Huntington's chorea. Huntington's chorea is a genetic disorder, usually appears in male in their 40s. Okay, and we will also explain that in differential diagnosis for neuro. Clonus is a rhythmic involuntary oscillations of a muscle and joint in response to sudden stretch in patients with upper motor neuron disease. Clonus is typically tested at the ankles, wrist, and or jaw. For upper motor neuron lesion, you have certain characteristics like increased tone, hyperreflexia, like clonus. So clonus is one of them. When I'm doing a sudden stretch of the ankle, you will see rhythmic movement happening at the ankle. This is rhythmic involuntary oscillation of a muscle and joint. Decerebrate rigidity, involuntary contraction of the extensor muscles of the upper and lower extremities because of an injury in the brainstem above the vestibular nucleus and below the red nucleus. And we need, we have a picture or diagram to explain what is the difference between decerebrate rigidity and decorticate rigidity, because here the difference will be in the location of the lesion. So depending on the location of the lesion on the tracts, because we have descending tracts. Some of the descending tracts are from the brain to the periphery are inhibitory, some are facilitatory. But here you need to know that decerebrate rigidity is extension of upper extremity and lower extremity, and it is involuntary contraction. And what it is a result of brainstem injury above the vestibular nucleus and below the red nucleus, above the vestibular nucleus and below the red nucleus. Decorticate rigidity is a contraction of the flexor muscles of the upper extremity with contraction of extensor muscles of lower extremity. So listen here, there is a difference. Decerebrate rigidity, extension of upper extremity and lower extremity, involuntary. Decorticate rigidity, flexion of the upper extremity, extension of the lower extremity. This posturing is a result of damage to motor tracts above the red nucleus. Above the red nucleus. The other one is below the red nucleus. This one is above the red nucleus in midbrain. Okay. Delirium. We have the difference. We have two things. Dementia is a gradual process of losing, memory, and it is irreversible. Okay, but delirium is temporary confusion and loss of mental function, often as a result of illness, drug toxicity, or lack of oxygen, and it is often reversible, can be reversed. If you treat the underlying cause, it will be reversible, or it would be reversed, but not like dementia. Okay. التواصل بشأن المساعدة في ملء أوراق الابليكيشن لامتحانات كندا أو أمريكا أو إنجلترا، أو الناس اللي عايز تدخل الكورس as a whole بالنسبة لامتحانات المعادلة والبي تي لايسنس، سواء كان في مصر أو سواء كان في الدول العربية البرومتريك أو في كندا أو في أمريكا أو أستراليا، او كذلك الناس اللي عايز تقدم على درجه الترانزيشنال دي بي تي من جامعه مونتانا الامريكيه، اللي هي مخفضه بنسبه 50% للمصريين والسودانيين والاردنيين والفلسطينيين تحديدا. حاليا يرجى ارسال رساله على الواتس رقم 00201115 988 2370 او 0020 102 7743 702. If you are interested to join the main course for the preparation for the license exam, please send me a message on WhatsApp number 0020-115-9882370 or 0020-102-7743-702. Good luck for you in your license exam preparation, and I will see you in the next topic. Thank you.